Nursing is similarly at an inflection point. It is a different moment for us here today. Today, we as nurses are witnessing a very volatile, very, very uncertain, very complex, and a very ambiguous environment. And after having witnessed the pandemic, we all agree that uncertainties and unpredictabilities will always be around us, and we need to be prepared. So our work as a profession cannot anymore hinge on our older value system or our traditional and orthodox ways of managing our processes, our people, and our environment. The legacy of the old values and our core values must be preserved while we look at adopting change and embracing and navigating our ways into the future. The need for change. Why? We all know multiple verticals in healthcare are evolving where nurses are involved today. We are seeing a lot of diversification, emergence of various conglomerates in healthcare, and this blurring lines of demarcation. We know it's a borderless world with boundless opportunities. So for us as nurses, the need to change is today and now more than ever before. And I think I see the new generation being very, very savvy to adopt and adapt to this change and acclimatize themselves for what is going to be the future of healthcare as we witness it today. So where do we go from here? We all know that today nursing profession requires a paradigm shift in every little thing that we do or we do not do. Nurses have a critical role to play by not only creating value, by addressing patient needs, but I think today we are in a position to address societal needs. We are here to address the policy issues in healthcare. And I think the day has arrived. It is for the nursing professionals to encash on this moment and leverage their expertise to build the future of healthcare. And I think each of us saw how each and every single nursing leader in this country and the nurses and their teams evolved when the pandemic hit us without any prior intimation. All of us should remember that what got us here won't get us where we want to go. As the global healthcare industry grapples with unsustainable cost trajectory, it is also facing an increased demand for healthcare services because there is an increasing pool of consumer patients and by growth in costly chronic disease management. And I think I hear my chairman say this every single day, that today India has become the biggest hub for non-communicable diseases. So the nursing profession needs to plausibly sketch out different strategies that the future could take. Nurses must respond to this change with an added agility. We must remind ourselves that what got us here will not get us there. This is the time that we need to reform. Merely hiring more and more nurses or trying to do some induction program or just teaching them basic skills will not address the plethora of issues that we are faced with. We all know that our healthcare environment is now talking about specialties, super specialties, and subspecialties. And this pragmatic change has to be adopted by the nursing community at large. We have to play the advocate and engineer health for the country. Health is not just about the treatment of a condition, but it is about social, physical, and mental well-being. And the focus of healthcare today is increasingly moving out of acute care settings. We know that today, as nurses, we provide care at homes, schools, in the occupational settings. And I would even say this, tomorrow, if probably there is a spacecraft that is going to the moon or to any other planet, I'm sure there would be demand for a nurse to be present in that group there. That's the future for nursing. So we need to shift away from this intervening in acute phase of the disease towards early screening, detection of treatment, as well as towards preventing the disease in the first place. So nurses have a big role in prediction, personalization, and preventive healthcare. However, every nurse today, in my opinion, should become an individual scientist, an individual engineer of healthcare, and not just a healthcare worker. Only then it would not be difficult to move beyond the horizons that we operate in today. The whole healthcare sector is on the cusp of a digital revolution. And there's so much that nurses can offer in this digital journey and transformation that is visible to us very easily today. The current healthcare milieu is an interdependent world and requires a global policy which is inclusive of nursing professionals. And a global governance framework needs to be evolved with ample nursing representation and definitely with multiplicity of other stakeholders. Though the boundaries between healthcare professionals are still quite entrenched, with advancing times, there's more blurring because it's nurses who are providing care to most of the people on this planet. So it's important for us to expect the unexpected, which shows a thoroughly modern intellect. 3/4 of our healthcare workforces are nurses, and with their intellect, with their energy, and their creativity, especially because they are a young brigade, I think we are poised to grow rapidly. This transformation journey for nursing will have its own sets of challenges and by no means guarantees growth. But with a concerted effort, I believe rapid, equitable, and sustainable healthcare delivery model is possible if we start giving nurses this opportunity, and if nurses seek this opportunity and exploit the opportunity and encash upon it, I think there's a great future for nursing. So delivering tomorrow, I think it's important to shed light into the black box that we call as future. Today, healthcare is poised to transform itself and improve the lives of its citizens, and it is being done with unprecedented speed. Nursing brings to the table a very rare set of strengths, a stable ethical structure that supports patient centricity. Our country would not boast of such great clinical outcomes if nurses did not deliver what they do. But unfortunately, the recognition has not been given to this group of people who are actually the anchor of the clinical excellence piece. Nurses bring a demographic dividend. They're from all parts of the country. A capable workforce which can adapt and adopt and are resilient. And there is a restless zeal and an enthusiasm in the nursing workforce. So armed with these advantages, nursing should seize the opportunity, which is such a unique moment, and it can become historical. Nurses must understand that social responsibility is conceptually different from just volunteerism or service learning. and it's not going to be a one-time experience. We have to understand that it's important to be involved in civics, the civic involvement. We must work for environmental sustainability and with respect for diversity, pluralism, and freedom of expression in an effort to optimize well-being. So it's important for us to define and develop ourselves. As the healthcare system evolves to meet these new needs, nurses are playing expanded roles. So nurses have to voluntarily spend a lot of time to learn the nuances of the new healthcare world. Emerging issues and emerging diseases will always plague the environment, and they will be changing technological standards, which will mean that nurses have to take on new duties, new roles, and have to spend a lot of time preparing themselves for just doing what the curriculum taught them to do. Emerging fields like genomics, genetics, informatics, telehealth, all this seeks nursing representation today. So these skills and competencies will become a norm for every single nurse into the future. So to lead the health team, nursing leadership will have to address these new capabilities. It's important for nursing leaders to evolve in order to make this paradigm shift into the future. We must lead the change by changing the way we lead. We all know that many nursing leaders have not invested enough time and energy to become true leaders through educational programs or leadership courses. Some of them have become by default. Many of them have worked their way into who they are. But I certainly feel it's important for us to move from tactical leadership to transformational leadership and distributive leadership, which talks about idealized influence. It talks about individual motivation, individual consideration, which is the new norm, which will foster team spirit and excellence. We need to step, vault, leap, and get out of the box. I think it's important that when we are faced with the challenge, most people tend to stick to their comfort zone and choose the path of least mental resistance, drawing upon tried and tested ideas that have worked for them in the past, rather than experimenting with new. So, however, stepping outside that comfort zone creates original and exciting solutions. And nurses need to transform into solution creators and problem solvers. And only then they will be able to ditch that stick they have been using for ages now. It's important for us to leapfrog into the future. We've come a long way. The last 2 decades has been an amazing journey. We have witnessed a lot of things which we have never ever seen before. And I think a lot of this has happened because of the insurance sector penetrating into healthcare, accreditations, bringing in standards. There is this ever obsessive quest for quality, thinning bottom lines. All this has made us do things in a different manner. And we have come a long way, and that's so great for our country. But I think it's important for us to calibrate that speed and accelerate our pace and leapfrog into the future. So while we use our traditional approaches to surmount our challenges, I think speed is important. We need to adopt new and different approaches and technologies that may have been developed in other industries, but will also work in our setting. And we need to skip a generation or create an entirely new method of business model or technology in order to see how we leap into 2050. So nursing stands on the cusp of a major change, a transformation that could lead to unprecedented intellectual growth, which is paired with radical improvements in Human Development Index. Nurses are also more empowered to demand for change today, thanks to the ever greater access to the best practices of the world, to research, to this networking and connectivity that we are able to leverage, and with our counterparts across the world. Complicating things further, all these sectors are interconnected. A setback in one spawns setback in others. Improvement in one enables improvement in others. So we need to define this vector of growth with which to assess growth performance. Linear growth in each will not be enough to enable growth envisioned for nursing. Given the complexity and scale of the challenges we are faced with, the resources required and the urgency of demands for change coming from patients, from media, from sector players must deploy solutions that deliver non-linear growth. Nurses have to understand the market, the business, and the healthcare environment, which offers them opportunities to transition into strategy. It's important for us to forecast the future. Customers' future needs should be our cornerstone in preparing for the next decade of nurses and beyond. The same can be done through ensuring that the curriculum includes customer centricity. Students, in my opinion, should attend big conferences, must get an exposure to the environment that we are, must be introduced to the language we speak. I know I speak a little different language from what nursing generally speaks because I'm talking about the future. So I'm not going to speak what I spoke for many years. My language, tone, tenor, candor will be different because that's my topic too. Nurses have to understand the major trends that play a role for customers and find solutions and strategies going forward. And this is the ethos on which we need to train our next generation. So it can't be just teaching them the basics of patient care. It is also teaching them customers' future needs. We all know that today nurses cannot be generalist nurses. They have to be highly advanced because our environment is complex. We are doing innovative, breakthrough, first of its kind work, and patients reach out to those institutions and hospitals that offer those kind of different modalities of treatment, which have more accurate results. So nurses have to be introduced to advanced practice, and they should be specialists and super specialists and at the cutting edge of the future. Nurses must undertake a lot of patent work, must do innovation, should do research, should bring in more evidence-based practice, should have their own publications. And it's important for us to learn from the world of the nursing where a lot of good work is happening and adopt those different practices to take care of our patients, our consumers, our clients, and the organizations that we work in. It's time for nurses to expand beyond their traditional roles. So it's beyond bedside. I feel for me, the nurse, when she graduates, she must be mentally prepared that she might be moving from the bedside to the boardroom, even as a very, very young nurse. So nurses today are tasked with a wide range of healthcare responsibilities. And we all know that every single nurse today has to face the NABH, the JCI, or any audit that happens in the hospital. So they're not a small person in the entire ecosystem. So that training for leadership, the training for managing a few nurses under her starts from the day she assumes her professional responsibility. As the largest group of healthcare professionals and a principal interface between healthcare organizations and their stakeholders, it is vital that nurses move into healthcare governance roles. Today, though they are lacking the expected quality care standards, nurses are being an enabling force for change. So it's important for every organization to nurture that leadership in nursing, which will take the nurse from the bedside to the boardroom. Frequent catastrophes have led to a paradigm shift away from efficiency maximization to vulnerability mitigation and resilience. So this whole conceptual framework for nursing healthcare quality should address two dimensions: components of healthcare quality and consumer perspectives of healthcare needs. Both should be taken into consideration. So for us, what is important is to include safety, effectiveness, patient-centeredness, and timeliness. And it is important that the consumer's perspectives on healthcare needs should get considered. And I think nurses can play a big role in getting that patient's feedback in preparing the policies for the organization. Strengthening the commitment of nurses with nursing knowledge is important for them to better address these global changes that are taking place. I'm really glad to see, many nurses being sponsored for various conversations at various levels. And these should be young nurses who are at the bedside, wanting an opportunity to speak up for the larger good of the healthcare ecosystem. Emerging specialization. This is a pathway from generalist nurse to specialist nurse, which should be on similar lines as is on any other career or the medical careers. So today there is a lack of definition of nurses' role, the scope of practice, the titles, lack of clarity concerning career pathways and educational preparation for advanced and specialist, super specialist roles. But I think for me, the future will be about specialty nursing, and that needs to get addressed at this moment of our preparation for the future. In a world where individualization and personalization are the consumption of the generation here today, I think our pervasive generic strategies will become absolutely obsolete. There is a change in today's paradigm. The patient has become the focal point. No more it's the healthcare organization or the doctor dictating terms to the patients. It is consumer driven. Treatment will become absolutely personalized, especially with artificial intelligence coming in. Stuff like Pro Health, where we produce personalized solutions. We can detect diseases of the future, stuff like that. With nursing technology, which is being tailored to the specific needs of each individual's disparity. Delivery as it relates to racial, socioeconomic factors in priority population. I think today every single nurse has to start speaking this language. They have to understand beyond just doing daily bedside patient care. This is the future of nursing. I think it is important for us to start seeking solutions from technology experts. And I know for one that I myself speak to a lot of tech experts. They love to produce solutions for healthcare. We need to discuss our problem. There are expert minds in the country that will come up with solutions for us. So it's important for us to engage with these kind of stakeholders. This savvy deployment of technology could help nurses implement very smart solutions to complex problems. So bridging these solutions, bringing in the Internet of Things, satellite and mobile-based distance monitoring programs, these can all become a great aid for nurses to work into the future and look at vocations which bring in a lot of experience, expertise, and good remuneration for nurses in this space. So the technology-led model of healthcare is standing at our doorstep. Nurses have to use that opportunity to become highly scalable. Hundreds of new medical apps, and I know there are many, many nurses who can design apps. This young generation is very, very savvy. I know of nurses who are very, very fond of gadgets. I mean, rather than send them to a store which looks at clothes, they would spend time looking at gadgets in a branded store. That's the young generation, and I'm talking about women. So an array of these new technologies should become our daily working tool. And I think nurses have to brainstorm together. What is it that we can bring into the organization, which can help us take away a lot of non-value add jobs and make life simpler, and we can deliver better quality care with more mathematical accuracy and probably robotic precision. The logistics for future has to be created today. So all the scenario planning, which has emerged as a proven approach to navigating through the uncertainties of our workplace. I think we do a lot of tabletop drills and exercises. We have to do similar scenario-based exercises to see what the future will look for us. We need to deep dive into the succinct summaries of the vulnerabilities of our proposed policies and plans. Will our policy of today be good to us in 2050? We should embark on a mission to confidently craft these policies and plans that can take advantage of future opportunities. It can avoid potential risks and engage diverse stakeholders in the planning process. And I know nurses are of great value in an organization that talks about how can we mitigate risks in the future. I think organizations have done very well when they have involved nurses in planning for such uncertainties. It's important for us to develop global resilience while we still seek local adaptation. Nurses need to help communities across the world to build ability to survive, adapt, and progress into the face of stress without distress or loss of assets. The aim should be to build capabilities, capacities, which will be evolutionary in nature with an increase in risk retention capacities. So why is the community not catching up? We are speaking such big language. Why are we not there? Why haven't we started to talk about the future? I think for me, the problem lies not in the lack of knowledge, but there are many, many barriers for translation of that knowledge into action. The most critical being lack of platforms and communication channels, which can enable knowledge generators, knowledge transfers, and communities to learn from each other and co-create solutions. So I think this clinical partnership gap which exists today should be broken. The communities whose resilience is at stake will need to learn from people who have walked the path. We need to help community to help themselves. I think nurses play a big, big role in strong institutional partnerships, and they can have targeted and localized communication strategies. They can pilot and validate with community and create technical solutions. They can design and incubate financial products. And there's so much more that nurses can offer in helping communities to help themselves. We must understand the theory of change. It starts at an individual level, then at an interpersonal level, at an organizational level, community level, and then the societal level. I think it's important for each and every single nurse to operate in every sphere in the circle here today. Energy is the lifeblood of global economy, a crucial input to nearly all the goods and services of the modern world. And I think nurses need to rise to the challenge and become advocates for health beyond the walls of hospitals and right to the point of origin. And I think ANEI, for one, has started nurses to work in the environmental space. So I think a lot to give back to the world that we belong to. And nurses must play an important advocate for environmental issues. Effective clinical reasoning, we take a lot of things that just is given to us. And I think it's important for us to take the right cues, the right action for the right patient at the right time and for the right reason. And young nurses must begin to question the norms and bring in clinical reasoning into their day-to-day practice. Learning to reason effectively does not happen just like that. It requires determination and an active engagement from every single nurse, and she must practice continued learning in order to practice clinical reasoning. I think with nurses trying to talk about the future, there will be prosperity all over, everywhere. As a profession that is deeply invested in improving the lives of people, we should find ways in partnering with governments across continents to help us in this cause. New revenue raised equitably and spent efficiently can enhance the lives of citizens across the length and breadth of the world. And I think nurses should enhance lives of citizens across the planet. They can, they will, and they should. Cultivating cultural humility is important for the future, breaking down stereotypes. It cannot be collapsed into a classroom or an educational offering. It's an ongoing process. Today, nurses who are young have adopted technology and have been in social media. They must reach beyond their own networking abilities within the hospital community. They should know there are people across the world who need support, who need help, and we can learn from them too. So reaching out is very, very important. And that cultural humility will bring in a lot of value for the nursing in the future. We all know, I mentioned this earlier, that from data to predictions and decisions, enabling evidence-based healthcare is the norm for the future. So personalized medicine, predictive medicine, preventive medicine. One must understand this is the future. Nurses must take opportunity to work in this space because this is where the world is moving. Communication is key. Making meaningful use of communication skills to demand appreciation for the work we do and to be inclusive in the future is what the nursing teams have to learn. Nurses are at the heart of the communication process. They assess, record, report. They handle a lot of information sensitively and confidentially. But speaking up at the right time, at the right place, is a crucial skill we must develop to lead us into the future. Accountability is the glue that ties commitment and results. And I think we all understand that the workforce that we lead is accountable for the work that they do. But we must work on this core strength that we have in order to take us to where we wish to be. Moving the world forward together, which is a rich phenomenon and with inherent ambiguities. It calls for a characterization that preserves those shady edges rather than being drowned in the pretense that there is a formula and a sharp delineation waiting to be unearthed that will exactly separate out all the sheep from all the goats. The concept of social responsibility is strongly linked to the values of the profession. And I keep on repeating this social value in every sentence that I bring in, because I feel it's important for each of us to move beyond the boundary wall that we operate in. We must catalyze breakthroughs. Leaders often do not realize the critical role they play in creating an environment ripe for ideas and innovation. Unleashing that power and potential of a nurse is crucial for each of us to develop breakthrough strategies that help us deal with complex situations of today and of tomorrow. We all know that the wheel is not perfect. We need to make it perfect. We've evolved just like the wheel. So there is no one size fits all solution here. We need to build our own wheels for the future. I don't think anything should come our way. We should not let things that could have been get in the way of things that still can be. On that note, I thank each one of you for listening to me. I know maybe I spoke a little 30,000 feet kind of conversation, but then if we have to get into the future, we cannot be talking the language that we did from the time Florence Nightingale constituted our profession to where we are today. We have to start talking at least 2050 from today. And for me, nurses are not just clinical entities. They are business entities. They are social entities. They build communities. They build nations. And for me, nurses contribute to the larger good of the world and for the planet. So we must encash on working in every space that belongs to healthcare. Thank you.
Thank you, Captain Usha, for that exemplary talk on how you should look forward to the future and what plans we should make to have a paradigm shift towards looking towards the future. I'm sure thousands of nurses across the country and probably beyond had been listening to you today live. Yes, it is time that we surpass whatever we had been doing so far. Not by not doing it anymore, but doing much beyond that to reach out there what is waiting for us in the future. We are at a turning point in the healthcare today. We being nurses are so lucky to be part of it, where we are looking forward to the future, which is going to be so promising if only the nurses take part in it more actively than ever before. Hence, yes, it is very important that we move away from our traditional roles, and it's not that we don't do it anymore. Yes, we will continue to do that, but look into the future and what is the requirements of the future. So for this, as you said, there's a lot of mental tuning is required. We have to learn a lot of new terminologies, new skills, and integrate those things into our everyday practice. And thank you so much for highlighting on those things. I'm sure all those who were listening to you would think about it, make at least one part of it what you have talked into their daily life, so that future is promising for each and every nurse in this country. I would like to ask the audience, if you have any questions, maybe you can put it in the Q&A box. I have got one question here in the box. Where there is more demand, respect and value for nurse in other countries like UK and so on compared to India. So why is there that more demand in other places than in India is the question. It is written anonymous attendee. So I don't know who is this person. Well, do you like to answer that?
Yes. My answer to that question would be that every country has gone through an evolution phase. I think probably today what we face in nursing must have been faced in many countries at some stage, maybe 2 decades ago. Um, but I don't agree to the fact that, there is no respect and there is no, um, what was the other word? Respect and demand.
Demand.
Demand. No, there is definitely a
And
lot of
value.
respect.
And value.
Value. Oh, dear, I've never felt, as a nurse, I have never felt that somebody has never respected me or somebody has not valued me as a person or my leadership for that matter. I think it is important for nurses themselves to have a paradigm shift in their thinking that, they are not respected. Every single nurse is respected, and respect will come out of our work, our contribution, and our camaraderie as a professional, how we see our profession, how we come together as a professional. And I think it is time that we stop painting this poor nurse, poverty-stricken nurse, and, coming from very poor socioeconomic backgrounds. No, we have come, irrespective of what's the background, what's the social standing, we are a qualified nurse. And I think, at least in my organizations that I've worked, wherever I have worked, I have 35 plus years of experience now, close to, and I think Captain Ajitha also would share this same emotion from my side. And nobody can build respect for you or for me. It has to be commanded by each one of us. And I think let us take a pledge today that as nurses, we will never say that India does not respect nurses. India respects nurses. I think there are other issues. You might talk about salary. There are other things. I think that's being addressed, and we as nurses should address that. If all the good nurses leave India and go, who is going to save our country? So this is revolution time. This is independence, pre-independence phase for us. And many countries have done that before. So my humble request is, I think let us never feel that we are not respected. We're all respected professionals. That's my answer. Sorry if
Absolutely agree, Captain Usha. We have to move away from this victim playing behavior. We always feel that we are targeted, we are not respected, we don't have value. This housewife syndrome has to go. So if that has to go, nurses need to have more courage. They should have better leaders to guide them. And this is sort of transferred from one generation to the other. So that has to go. So I have more questions coming. What are the nurse top leaders doing to make this change in the nursing community through policy making?
Well, I think you should, the generation that is a nurse today should be very, very glad that there have been leaders in the last 2-3 decades. Why am I saying years? 2-3 decades who have walked an uncharted territory and created a beautiful world for the young nurses today. I think that's been a complete transformation in the last 2.5 years. And today, if nursing has come this far, I think it is a contribution of the key leaders who are holding the mantle. Good academicians, good hospital administrators have come this way. But I think it's important for every single member of the nursing profession to contribute and hold hands and join hands in that journey. Nursing leaders are trying a lot of things, and I think you're a recipient of what we do, whether it is welfare, education, in-service education, creating good policies in the organization, ensuring that their grievances are redressed, ensuring that there is a work environment which is more safe, protective, and which is very involving. The nursing leadership is today, I think, probably a part of every single committee in the hospital. So the positioning part. So there's so much that has happened just because there are nursing leaders in the country. who are trying, who are giving their best, and who could have also gone away somewhere to some beautiful country, but have stayed back to make that difference. But I think today it is for each one of us to give it the best we can.
Yeah, thank you. We have our last question. I think it's almost closing to the time. So this question is from Indira Das, and it is about the media portrayal of the nurse in Bollywood. It's all about carrying a clipboard and the screaming at doctor in case of an emergency. And do we need to influence the media, or do we need to play a role in how the media picturizes the nurse?
Yes, I think it's very, very important. The media cannot portray anything untoward, but then, media portrays the police, the media portrays the armed forces, the media portrays a lot of things.
Politicians.
The politicians. So I think every profession comes under attack when it comes to films. But then I think our view, unless it's very, very derogatory and it is hurting the professional sentiments, we should let go of movies as movies, and our patients should see better value for what we bring to the table. And each one of us should be an advocate. But yes, if there is any sexual tone to our portrayal, or it's very, very abusive or derogatory, we must write to whoever is making that film and we've done that in the past for a couple of things, isn't it, Captain Ajitha?
Yes, absolutely.
May not be for films that, how influential could we be, but yes, we can. And as an individual nurse, you can also put up a social media tweet or whatever.
Yes,
and
respond to it
campaign. It's your right as the freedom of expression. You could lead a campaign. Everyone can do that.
Yes. Yes, and we end up just complaining and not doing much. That is one of the problems what we have. And responding to it positively and talking about solutions and leading such opinions is what every nurse can do in order to manage a positive image in the media. In fact, I would rather dream of a new world, where there is a reverse flow of nurses. Can you imagine a time where foreign nurses come to India to work here? That I really feel that day is not long away. I don't know whether it will happen in our lifetime, but then it is not long away, in fact.
Captain Ajitha, I would like to add a word there.
Yes.
I certainly feel this is like an independence time for us, just around that 1947 for nursing. I think we all, each and every single nurse today has to probably give and sacrifice a little bit to make Indian nursing better. And if we do that, I don't think there would be any dearth in any citizen from any country coming to India. India will value, but today there are no nurses here. Everybody who joins the profession wants to go away, right? So unless every single nurse joins this journey, nothing is going to change.
Yes, and that, of course, we being the largest production center of nurses in number is the force, actually. So if everyone is oriented to right from they join in first year of nursing, if they are oriented to that, they also have a part to play in improving the status of nursing, the level of acknowledgement by others, the recognition by others. I'm sure that it is going to be.
It's only we as each and every nurse who can make nursing better in this country. And I think today every single nurse has to do that. I mean, for the next 10 years, we'll have to do the sacrifice.
Yes.
We'll have to do. And you and me have sacrificed. I mean, you have not left the country. I have not left the country. And we
never thought of it, in fact.
Yes,
so and each journey to outside the borders have reinforce that yes, our decision was right to stay back in our country. That's what I basically feel. Yes, but yes, it is not easy to survive here, but it's not that difficult either. It's not a comfort zone. Yes, if we all are comfort zone loving people, then there is not so much to complain at the same time, right? So fight the battle with all your might. which we are sure to win. And that is the battle for the cause of the patient. So the nurses today have to identify what are those consumers' costs and stand for it. I'm sure everybody will line up behind us because everyone in healthcare is struggling. How do we meet the demands of the patient, the requirements of the patient, the safety issues? So we have to identify that we have to play a big role in this. Instead of playing a victim that, oh, we did not have this, we did not have that, so someone said this, etc. So if as you said, if we want to survive, you need to be adaptive. You need to be understanding what are the changes happening in the society as well as in healthcare, and adapting ourselves, finding new ways how we can contribute to various things in healthcare. So with this, I think we should, it is 4 o'clock and we should wind up on time. And I would like to thank you. Thank you is left for Mr. N.K. Raja, but however, I would like to end by saying thank you to Captain Usha Banerjee. It was such a versatile talk and engaging talk. I'm sure the thousands of nurses who had been listening to you would have felt more energetic to contribute to the cause of what we were talking today, looking into the future of nursing, a paradigm shift. And I would like to place on record my sincere thanks to Dr. Girdhar Yani and Mr. Shikhar Gupta from AHPI for reaching out to us for organizing this, and also Mr. N.K. Raja and Vijay Surya from the Micro Labs team, and also from the ANEI team to put it together. Dr. Rosalind Rachel and Dr. Ajitha for helping me in putting this together to identify very relevant topics to the nurses for the current times and identifying the right speakers for that. So we have a series of well-known nurse leaders in this country who is going to talk about the topics which I have mentioned earlier. And of course, this is our contribution, part of our contribution to the Nurses Week. And we have a very beautiful theme for the year, and wish all of you out there a very happy Nurses Week and Nurses Day, and the most active part of our 1 year is this Nurses Week, in fact. So I'm sure everyone is very busy, but there had been a lot of people. I had been seeing a lot of photographs, everyone sitting in group and listening to Captain Usha, and I'm sure all of them would have benefited. Thank you so much, and over to Mr. N.K. Raja for the closing remarks. Thank you.
I think it's an honor to listen to two of the best of the captains in the nursing profession today. In fact, we hardly have the time to listen to such topics other than we meet as a patient, a nurse in the hospital, but very rarely get an opportunity to listen to such kind of wise words. In fact, as Dr. Captain Usha Banerjee have mentioned it, now one of the theme of today's this year's theme had been that our nurses and our future. And it was so glad to hear from her the opening talk on future of nursing, a paradigm shift. So it is not very aptly, we have given a very good start, keeping the theme in mind. And I think Dr. Captain and Dr. Usha Banerjee have really dwelt in detail with very simplified slides so that each and every nurses get the take-home message. So thank you very much, Dr. Usha, for having spared your valuable time and come over here for today's session. Yes, ma'am. I would like to sincerely place on record Captain Ajitha Nair's contribution to this overall the planning of this program. So it's not just an initial start, but not without your support, ma'am, we could not have designed the entire program. So thank you very much for your valuable time too. Not the least, I would like to also thank the complete AHPA team, including Dr. Girdhar Yani, Dr. Alexander, Mr. Shikhar, and my colleagues Vijay and Ravindran, Prabhakaran, all of our Micro Labs team, who have also tried to coordinate and see to that the message is getting percolated to the thousands of nurses across the country. We're very happy to see more than 1,000 nurses are getting registered on the day one. Was a bit of a short notice, but today we have ensured that we will be circulating in all the groups. So hopefully we should be able to target at least 10,000 numbers for the next couple of days, so that it should be the culmination point of International Nurses Day. We should have the peaks of the best of the maximum participation, so all the nurses get benefited out of this overall the scientific session that we are trying to develop. So with this, once again, thank you, Captain Dr. Usha Banerjee, as well as Dr. Captain Ajitha Nair, for having spared your time. Thank you, all the nurses. Without your participation, we would not have made this session a fruitful one. And we look forward for your next session tomorrow at the same time. Thank you very much.
Thank you.